Unfortunately, tragedies like this one in Wisconsin have actually happened here in the tri-state before. WCPO 9 News reporter Josh Bazan spoke to an expert in emergency medicine about how hospitals respond and what people should keep in mind at major events like these.
There's always different factors to be considered depending on what environment we're in.
After a driver killed at least 5 people and injured more than 40 others during a Christmas parade in Wisconsin Sunday, one doctor expects security measures to ramp up locally.
I would expect to possibly see some different measures in upcoming events in the next few weeks, months, and possibly ongoing.
Dr. Randy Marriott is the medical director for the EMS Center of Excellence at Premier Health, which includes Atrium Medical Center in Middletown. He says individual safety plans should change based on the type of event, the location, and other factors.
Look at exits, look at barricades, look at places that would be safe points.
Here in Cincinnati, plans are still moving ahead to host the annual Price Hill Thanksgiving Day Parade.
I have a lot of confidence that people will show up and join the fun of the day because we all know that there will be ample security there.
Cincinnati police say permanent bollards like these have been installed over the years here at the banks and in other parts of the city. They're an extra safety measure that came about after Cincinnati experienced a tragedy similar to what happened in Wisconsin. In 1999, a drunk driver crashed into an Oktoberfest crowd, injuring 27 people. Cincinnati police now rely on reinforced barricades, larger traffic buffer zones, and other safety measures to protect the public. Something similar happened at Westchester's Memorial Day Parade in 2010, when a man who was going to drive in the parade accidentally drove into the crowd, injuring 6 people. After what happened in Wisconsin, Dr. Marriott says hospitals are also constantly updating plans for mass casualty events.
40 casualties down Main Street. Alert all the hospitals.
Sometimes these things can happen very quickly. If you're in a trauma center, obviously you put out trauma alerts that you normally would.
At the banks, Josh Bazan, WCPO 9 News.